Welcome to Coronavirus, The Rundown. I'm Usher Qureshi. Each day we showcase how American communities take on the coronavirus and break down the headlines. Today, new unemployment numbers. The Labor Department reports 3.2 million new unemployment claims last week. The total is now 33.5 million since mid-March. Economists are hopeful because this is the fifth week that weekly numbers fell. A new potential coronavirus vaccine is moving on to human trials. Moderna got FDA approval for a 600-person study set to start soon. The company will add more people this summer, then do a third, bigger study. Researchers have now corrected a study that claimed 88% of coronavirus patients on ventilators died. The study, published in JAMA, looked at patients in one New York hospital system. But after other hospitals raised concerns about the high fatality rate, researchers now say 24.5% of those patients died. We mentioned the unemployment rates. Alicia Nieva is looking at the bigger picture.
Around the country, roughly 30 states have begun reopening. More people are going back to work, and fewer are filing for unemployment. In fact, the Bureau of Labor Statistics just reported another week of declining jobless claims, with last week's number coming in at just under 3.2 million.
That's less than what we've seen over the last couple of weeks, but still, to kind of put this all into perspective, before the coronavirus, jobless claims in the U.S. were running around 215,000 per week.
Ryan Sweet is an economist at Moody's Analytics.
The job market's going to take years to recover from this. We're not going to just be able to turn the light switch back on and all the employment comes roaring back.
In addition to this week's jobless claims report, the Bureau of Labor Statistics is preparing to release the unemployment situation on Friday. It will tell us what percentage of Americans lost their jobs in April.
Our forecast is about 15% unemployment rate in April. The peak unemployment rate during the Great Recession was 10%. The unemployment rate is likely going to head a little bit higher in May before it starts to resume declining.
Sweet sees job growth in specific industries leading that decline. And for people needing a job right now, what are those industries?
Industries that are low person-to-person contact will be the ones that come back first. And those that have a lot of person-to-person contact or jobs that are related to large groups, like think sporting events, concerts, they're going to be the last ones that come back.
Moody's Analytics believes the fastest bounce back will happen in construction and manufacturing.
For example, auto production should bounce back pretty quickly over the next couple of months.
Most analysts and economists believe that we will end 2020 back at a single-digit unemployment rate, but a high single-digit, right around 8 or 9%. We're probably going to stick with that number for quite some time. Before COVID-19, we had an unemployment rate of less than 4%, and Moody's Analytics believes that it'll take us several years to get back to that place. I'm Alicia Nieves reporting.
The United Nations is warning the coronavirus could boomerang and come back to certain countries, including the U.S. Leaders say wealthier countries should work closely to help make sure there's no major second wave. The group says it will ask the richest countries to donate $6.7 billion to fight the virus in developing countries. Well, a lot of misinformation about COVID-19 is spreading, especially on social media. Some of the most common but incorrect claims are that the coronavirus is not as deadly as influenza. Doctors say while we are still learning about the new virus, numbers have already shown that it spreads much quicker than the flu. Coronavirus also has a higher mortality rate, even with early numbers.
If you estimate, it has been estimated that even though we've detected 1.2 million cases, there may be 10 times that many cases that are currently have existed in the United States. So if you do the math, that puts you at roughly a 0.6% mortality, which is roughly 10 times that of influenza.
Dr. John Hammer says there may be 10 times more coronavirus cases due to several reasons. Not everyone with the virus has been tested due to lack of access. Others may not have been tested or tested positive because they were asymptomatic. Dr. Hammer also adds that if we don't take coronavirus seriously, it can bring additional consequences, even if we are not dealing with the disease ourselves.
But we really don't want to get back to the point where we were, say, a month ago and have another resurgence that might overwhelm our ICUs, because if that happens, then people with other illnesses might not be able to access the care that they need.
With the flu, the big difference is that there is a vaccine that provides some level of protection. There are also several coronavirus vaccines in the works right now, but Dr. Hammer says the pandemic can still take another course between now and the time the vaccine becomes available. People and organizations are doing what they can to get on a path toward normalcy. Our partners at Newsy asked a Broadway singer about his path forward.
I am Brian Stokes Mitchell. I'm a performer, actor, singer, and I live on the Upper West Side of New York City. Right now we are in Riverside Park. About a month and a half ago, I contracted something that I wasn't sure what it was. As it turned out, it was coronavirus, and it hit me pretty hard. And at some point, it also started moving into my lungs. But fortunately, it didn't get too far there. That happened for about 3 or 4 days, and then it seemed to stop, and which is good for somebody who's a singer.
This is for you guys in the ambulance. This is for all of our workers. This is for the firemen that are down there. This is for all of the essential workers.
I got the idea to sing The Impossible Dream on my balcony, kind of spontaneously, actually.
This is my quest to follow that star. No matter how hopeless, no matter how far.
I had been going to my window to applaud the essential workers of New York at 7 o'clock every night. The city here erupts in just this wonderful celebration of pot banging and horn honking and whoops and hollers and applause. And on one particular day, I realized my lungs were feeling pretty good.
The unreachable star.
But I was beginning to get a little nervous because also the drivers, if I'm singing in the window, the drivers are there looking up in the window as well, and I know they're not paying attention to the pedestrians as they should. And I thought, this is an accident waiting to happen. So I talked to the NYPD, and we had a conversation about it, and they were having the same kind of concerns. So we both mutually agreed that it was a better idea not to sing. And I'm still going to be there at 7 o'clock every night with my neighbors, cheering them on. The NYPD, the fire department, the EMS workers, the healthcare workers, the delivery people, the people that are working in our grocery stores and in the hardware stores, all of the essential workers that are keeping New York up and running. I will still be there for them every night, cheering them on.
Everybody, thank you, New Yorkers. God bless you. Let's keep loving one another.
Teachers in some rural areas are having troubles connecting with students, while some experts think the disconnect will have impacts beyond school. And an update on when we might be able to find disinfecting products on store shelves.
Visit theindychannel.com/rebound.
It's going to be a while before we see more cleaning supplies on store shelves. Clorox says it won't be able to fully stock shelves with disinfectant wipes and other cleaners until the summer. The company says before the pandemic, the only time it would see a spike in sales was during flu season, so it wasn't really prepared for such high demand. Teachers in rural areas are having trouble connecting with students, and now education experts told Kai Beach schooling needs to change or more students will fall behind.
Do a wheelie, Turtle.
I can.
Yeah, you can. Andrew Sanchez and his wife Brianna are both teachers and parents living and working on the Big Island of Hawaii.
You teach at Ke'au High School. Our district that we live in is called Puna. So the district of Puna is enormous. It's the size of the island of Oahu.
When COVID-19 concerns closed their school, the Sanchez's transitioned from teaching in class to online, balancing both parent and teacher responsibilities.
Much?
Very good, my love.
But tasked with teaching from afar in an already rural community, they had big challenges connecting with their students.
We live in a rural community. There are people with no power. There are people with no running water. So how are we going to get them access to online learning?
Show us how you say hello.
Though their situation is unique, education experts say the Sanchez's struggles represent a growing section of the entire U.S. population.
There's a lot of concerns about access
equity concerns about technology and access to internet.
Colin Sharkey is with the Association of American Educators. He says e-learning can't quickly replace traditional learning, especially with a short period of time to prepare during a pandemic.
The amount of time that's being lost is multiplied by just how difficult it is for some students to even participate in learning.
With tens of millions of students now learning from home, Sharkey says the education system needs to adjust and curriculums need to change.
But really, we have a lot of kids who missed months of learning. You'll see an uptick in students who don't graduate or are unprepared for college if they do.
Despite the challenges,
You're good, Turtle. Stay on the side. You're good, baby.
the Sanchez's see value in their new virtual teaching techniques,
Man, these guys are pros. Whoa, watch out.
saying they're working on finding new ways to keep students motivated to learn during this crisis.
We're going to handle that, cuz. We're going to handle that. We're going to make sure the kids get what they need, no doubt.
I'm Kai Beach reporting.
Health experts at the CDC confirm it's less likely for us to get coronavirus while we're outside, but it doesn't mean it's completely safe. People should still avoid crowds and maintain 6 feet of distance from others. This information comes as more states open up parks and beaches. The new finding may also encourage policymakers to figure out ways to end lockdowns across the country. Well, video conferencing is a way to stay connected to our coworkers, family, and friends. But if you found you're more exhausted after video chatting all day, we're helping you manage the pressure. Lindsay Boach spoke with an expert who says there's a scientific reason behind this virtual fatigue and an easy way to fix it.
Zoom, Teams, House Party, FaceTime, all ways to get in touch with family and friends through video chat.
We're all in this together.
But experts say all of this virtual interaction is taking a toll.
We're all a little bit stressed. So what that means is our bodies are producing more cortisol. That's the stress hormone,
which can be emotionally draining. Cynthia Erickson is a psychology professor at Metropolitan State University of Denver. She says while we're in these video conferences, most of us are trying to multitask.
Instead of doing two things at once, what we're actually doing is we're task switching. So we're switching from one task to another. Every time we switch tasks, it takes a minute to get oriented, and it's also exhausting.
It's not just the work calls that are affecting us. Erickson says even the calls with our loved ones can have two consequences.
Hello. One, they're not the same as an interpersonal conversation where we might reach out and touch someone. Also, they remind us of what we don't have.
And by not touching our loved ones, we're not getting as much oxytocin or the feel-good hormone.
For the most part, many of these things are reversible. So as long as you get a good night's sleep, that's something that's reversible for many things. So some of these are temporary.
The structure of our day is changing. Many of us aren't commuting to work anymore. We're not spending as much time getting ready for work either. And instead, we're just waking up and jumping right into it, not leaving much time for ourselves.
I think it's really important to think, okay, what can I do to get fresh air? What can I do to connect with other people? What can I do to get exercise? But we know that we do need sunlight. We do need other people. These things are all really critical for our normal well-being.
And while we're in the Zoom calls, she says to focus on one thing at a time.
Even though it's really tempting to multitask because we have all these computers and all these screens, we get all this information, try to unitask. So instead of being a good multitasker, be a good unitasker.
Hi, baby girl.
I'm Lindsay Boach reporting.
Erickson also says the blue lights from our screens turn off the production of melatonin, the sleep hormone in the brain, making it more difficult to fall asleep. So if you have to use screens close to bedtime, she suggests adjusting the settings to a more yellow light. Well, one group of American citizens won't be getting a stimulus check.
You're penalizing U.S. citizens for a family relationship. And you don't become any less of a U.S. citizen because you're married to an undocumented immigrant.
The impact advocates say this is having beyond just the families not getting any money.
V6 working together, working for you.
Welcome back. U.S. Treasury Secretary Steven Mnuchin is being sued. It's because the Trump administration is denying federal stimulus dollars to millions of children because of their parents' immigration status. Chris Conti shows us what that means for families who are already struggling to make ends meet.
As the virus rages on, there are some communities being hit harder than others. While many of us can work from home, some don't have that choice.
The COVID-19 crisis has hit communities very, very hard because a lot of immigrants are in essential jobs.
Marion Davis is with the Massachusetts Immigration and Refugee Coalition. She's seeing immigrant communities being hit twice, once by the virus and then again economically.
There's a lot of people who are not getting their fair share of the stimulus and of the safety net that the federal government has provided.
Here's why she says that. By some estimates, 1.2 million Americans won't be getting stimulus checks because they're married to immigrants. It's part of the way the Federal CARES Act was written.
You're penalizing U.S. citizens for a family relationship. And you don't become any less of a U.S. citizen because you're married to an undocumented immigrant.
So what's happening here? Take a family of 4 with 2 kids. One parent is a U.S. citizen and the other is not. Anyone who files taxes with an individual taxpayer ID number is not legally allowed to receive stimulus funds, U.S. citizen or not. If a couple files taxes jointly, the entire family is disqualified from getting relief aid. Potentially $1,200 for the parent who is a U.S. citizen, $500 for each child. An estimated $2,200 this family won't be getting.
When you make that family poorer, that family is also not being able to pay rent to their landlord, not being able to buy groceries or buy other things in the local stores. Everything has a trickle-down effect, so you're hurting entire communities.
Only adding a layer of complexity as families try their best to rebound from this crisis. In Boston, I'm Chris Conti reporting.
Trump administration officials say this measure was signed into law by both Democrats and Republicans, but those suing the federal government over the stimulus money call the CARES Act discriminatory. Well, one class of high school seniors will celebrate graduation at one of the most iconic places in Indiana. Commencement will be held at the Indianapolis Motor Speedway, all while following social distancing guidelines. Students will get in their personal cars with family. Then there will be a procession through the town of Speedway to the racetrack. One by one, they'll get their diploma at the finish line.
It was a time for us to return a favor. Speedway High School is literally a few blocks from the Indianapolis Motor Speedway. We use their facility for parking for the Indianapolis 500 every year.
There will be no spectators in the stands. Speeches will be pre-recorded and live streamed for everyone to see. A nonprofit is helping make sure essential workers are getting enough to eat. The partnership helping to feed grocery store workers next.
Donation or volunteer today.
Welcome back. We like to end the rundown each day with stories that remind us of the good going on. Today, a nonprofit is helping essential workers and a catering business. The Center for Community Wealth Building in Aurora, Colorado, teamed up with a caterer who lost business because of coronavirus. They now supply meals to essential workers in a campaign called Meals for Unsung Heroes.
I never thought of us as being the front line until all this happened, and it's just amazing how nice everybody's been. The customers come up and thank us.
Now, once a week, I am guaranteed to be able to at least bring one of my staff on board, give them hours, pay them hazardous time, and also be able to feel good about providing meals to people who are in the front lines.
A GoFundMe campaign has raised more than $14,000 for the cause, achieving the initial goal. The new goal, $20,000. Well, that's all the time we have today for Coronavirus The Rundown. We'll see you next time. I'm Usher Qureshi. Thanks for joining us.